Here's another video on our series of crisis management interventions for ECMO. This is a tutorial on jumping the pump. So what do you do in the case of a pump failure? First of all, this curriculum starts off with, if the pump stops, clamp a line. We want you to be able to tell us why you would clamp a line. Prevent retrograde flow. And also, then there's a variety of reasons for the pump might stop. Sometimes you have to do the rest of this. Sometimes it's just read the screen and intervene and adjust some kind of alarm that caused the pump to stop. Don't always go straight to the worst case scenario. If indeed you need to change that pump out, then we want you to follow the rest of the systems here, which we will demonstrate for you over there, which involves moving the pump to a backup, either a backup motor or a hand crank. In the case of pumps without hand cranks, then you go to their secondary motor. And there's a couple elements here that are, all of this is transferable from system to system. There's a couple elements that are really important. You increase the RPMs before you move the clamp, again to prevent the retrograde flow, and you will increase the RPMs before you remove the clamp, down here again. You should turn the RPMs down before you throw a clamp on. Don't clamp the line when there's 5 liters a minute going through there. Turn the RPMs down. And let's see, that's probably enough. So why don't we jump over here and start working on the real system. So to continue our presentation on Jump the Pump, we're going to use this cardio help system here. So in the event that we were to believe that this pump has stopped, step number 1 is clamp the line. You could clamp the line anywhere. We're just trying to prevent retrograde flow. I'm going to reach out and clamp on the arterial side. The venous side would do just as well. That supposedly I did that because the pump had stopped. I'm stopping it now because we're making a video about a pump that stopped. If the alarm system was something that I could just reset the alarm and go back on again, then we should do that. But we're going to pretend that this has failed. So I need to now move this up into a hand crank. So let's grab the hand crank out of the drawer. This hand crank engages right in there, locks into place, unfolds like that, and we can fold this up. If the bubble sensor, if the SVO2 was connected to the circuit, we may have to disconnect that, and we're definitely going to have to disconnect this data line here because it's too short. Push the button over here, rotate this out, lift it up, and then note that the method for engaging the disposable with the hand crank is different than it is for engaging the disposable to the motor. This goes in with a twist in that direction. This one comes in with there's a little tooth here, there's a little connection there. We place that up there, pull this down, and there's a lever down here that you need to fold back. So we're gonna put the tooth in the loop. We're gonna pull that, put it down in place, make sure it's locked in. On top of this, which is gonna be difficult to see because of this crap here, there's an RPM meter in there. So as I start to crank, you're gonna see some lights light up, and those are I believe in thousands, and they're gonna tell you that you have 1, 2, 3, 4,000 RPMs. So once you get the hand crank up to, say, about 1,000 RPMs, you could come back around here and take the clamp off again so you can resume flow. Now, for the rest of this curriculum, the idea is that the person here is the perfusionist and you might need some help. So you're going to teach somebody else how to hand crank. So grab any other health professional around that isn't actively coding this patient and say, I need you to do me a favor here. Can you crank this wheel? So explain to them how to crank, explain to them what to watch for as far as the RPMs, where to keep that, and explain to them any other piece of data that's necessary, which might be like patient's blood pressure and patient saturation. So you just keep doing that. In the meantime, the idea is a console change-up. So we would have gone along and unplugged everything that's on the system and turned it off. Around here, this is some press and hold this button. And maybe even unplug this, because the object is to now, in this simulation scenario, say, this is a new pump now. The old pump is dead, the new pump has arrived, and we want to boot up the new pump while we continue the hand crank. So then if we pass this off to somebody, then you are free to make all these connections. So we don't have any data on here yet because we can't plug in because we've got to drop down. So now you could take the hand crank back from your assistant, and you could again warn the team that we're going to be without ECMO support for a moment while you take your clamp, reduce your RPMs down to 1,000, clamp the arterial line, disengage on the bottom, lock this out. Drop this down, latch it in, put the data port back on, and then come back around here and increase the RPMs to something around more than 1,000. If you have pressure monitors, right now you could tell what the pressure in your system is. 120, is that greater than the patient's blood pressure? Then we're going to flow forward with confidence. You can remove the clamp from the arterial side and resume pumping. That seems fast. There we go. Drop the chart. Put this all away. Just another day on it. Any questions?